Next up, let's look at the disorders of the digestive system. So we're not going to certainly name them all. I just wanted to go over a couple of major disorders that we see in digestion and get a sense of what's causing them and how we break down the terms that are associated with them. So first up, we have gastrointestinal reflux disease. This is terribly common, and it is going to come up in a later slide, so pay attention. So this is a picture here of the stomach, and there happens to be a lot of acid inside of the stomach. So as we swallow our food, that acid helps to break it all down because we certainly don't want to eliminate our food still in the whole form. We want to break it down and get out the proteins and the carbs and the vitamins and the minerals out of the foods that we eat for use inside the body. So that stomach acid is one part of the process that helps to break it down. But if you know anything about acid, right, it can eat through tissues. The good news is that your stomach has a really, really thick protective layer. However, most of the rest of your system does not, which is why the acid stays in the stomach. At the top of the stomach, there is a little muscle that when food is digesting, you can see in this top picture of the stomach here, should stay closed. And when that little muscle is nice and closed at the top and the bottom of the stomach, all of the acid in the food stays inside the stomach until the food is digested. If, however, like this bottom right picture, that muscle at the top of the stomach doesn't properly stay closed, some of the acid can start to come back up. Most of us would really call this heartburn. Okay. However, this is gastrointestinal reflux disease because that muscle, for whatever reason, and there's a lot of causes of this, remains open and the acid starts to come back up. The bad news is you feel terrible. Okay? Your chest is often very painful, and that acid can start to eat a little bit through some of the tissues inside the body. Okay, next up is peptic ulcer disease, and this actually goes with the last one we just looked at. So we did talk about all of that nice little acid inside of the stomach, and that we have this lovely layer of mucus that lines the stomach, and a little bit into that first part of the small intestine, the duodenum, as it starts to get digested. It shouldn't come up the other way, up the esophagus. So rewind this video a little bit if you don't understand that concept. Again, please rewatch. What does happen on occasion is that the acid or the mucus starts to thin out, which allows that acid to start to actually eat through the lining of the stomach. And again, there's a number of reasons that the mucus in the stomach can become very thin and allow this to happen. Bacteria is an extremely large cause. Some things like stress and other untreated disorders, right, can cause that mucus to thin, but you actually see a nice little hole or a sore here in the lining of the stomach. Okay, next up is a disease called diverticulitis. And so diverticulo actually refers to pouches. So what happens is that you get these little outgrowths or pouches into the large intestine, and you can see them here in this picture. And what happens is it causes a great deal of pain because as the food goes through, it gets caught in these little pouches, particularly small foods like seeds from strawberries, nuts, and other, and it can create this massive amount of inflammation. There's not an awful lot we can do to decrease the pouches. Oftentimes we either have to change the diet or get a surgical intervention. So let's break down the term diverticulitis because as you'll see with a lot of diseases, whether it's gastrointestinal or other, the terms themselves will lead you to what those diseases are. And so take a moment, break down diverticulitis, pause the video if you need, and then check your answer with us. Okay, so in the case of diverticulitis, there is no prefix. The new root term diverticulo refers to having that pouch or that outgrowth that builds up inside the large intestines. And itis refers to the inflammation or inflammatory piece of this disease. So diverticulitis is inflammation. It creates this little pouch, right? That food gets stuck, creates lots of pain. So again, I just want you to look at those terms. And if you really understand medical terminology for a lot of diseases, not every disease, but for a lot of diseases, you're able to sort of understand what those diseases are by just simply breaking down the words. And that's why we do medical terminology as a more intro level course, but this really supports all of the other coursework that you're going to learn. Next up is constipation. Most of you have probably heard of constipation, so it's probably not something that's entirely new to you. But what happens is the feces becomes hardened and it becomes difficult to have a bowel movement. There's a lot of reasons that the feces can harden, but essentially there should be just the right amount of water inside of it to keep it moving through the intestines and to be able to expel it from the body. If we pull out too much water, it becomes hardened. So of course you're going to have trouble using the restroom. When it becomes hardened, it also widens inside the large intestine. So if you look at this x-ray, there's a couple of circles on them, and you can actually see the intestine is so large inside of these x-rays, and that is actually feces that's become hardened inside of the intestine. Until we add a lot more fluids back into the feces, they're not going to be able to expel this. So all of the treatments we give include different ways to introduce water back into the stool. Next up, we have our opposite, which is diarrhea. Again, this is probably something that is common or that you're familiar with. But on the flip side, the stool and the feces become a little bit too fluid filled. So too much water, which makes them extremely loose and they don't sort of stick together. So when it comes to stool or feces, you do want the right consistency when it comes to water. Now, some of the reasons for diarrhea and too much excessive fluid is if it's moving through the intestines too fast. This often happens with things like food poisoning, right? Will cause it to move very, very quickly through the intestines. Therefore, right, it makes it nice and loose and watery. So what we do actually want to do is slow down the intestines in this case, allow some of that water to come out of the stool so that it can become more solid.